Everyone is counting, isn't it? Yeah, okay. Well, here we're doing a tongue diagnosis. Can you stick your tongue out, please? No. That's it, you hold it, yeah.
Too tricky.
Yeah. Okay. Well, what we can see is in the centre of the tongue it's more red. It's slightly more redder. There's a little bit of tremor on the tongue. It's shaking a little bit. So that's relating to the liver. And then there's like a little circle there. A little circle. And there's a fissure here. That fissure is lung area. Possibly touching on lung-heart area. So it's showing a weakness in the chest. It's quite open as well. And there's a bit of an ashy colour in the substance. It looks a bit like someone smeared a bit of ash on it, just around that area. You can see it without the light better. So that shows that the blood's not moving properly. It shows a weakness in the lung. On the tip here, there's a fissure on the centre. And that shows the heart is affected and it's emotional. So it shows an emotional factor. And also a weakness in the heart on the upper part of the body. You stick your tongue right out?
Sorry. Oh gosh.
Big mouth. Trying to look at the back here. There's a slight slimy coating which is damp. And the tongue itself is quite puffy. It's actually quite, that's why we can't see it at the back. So that is a damp retention. And also near the tip there's a white patch.
Oh, yeah.
That white patch shows the lack of circulation going to the extremities. So she's got some redness, which is heat in the blood. She's got some problem with the heart and the circulation. She's got some internal dampness. She's got some liver wind. And then round the lips there's a greenish colour which shows indigestion. It's also the colour of wind. And this area here is slightly reddened going down to here, which is more reddened, which shows heat in the kidneys. This area here is red and it shows general heat in the body. That area is slightly paler, which shows that the heart's deficient. And this is slightly sort of redder or congested in some way, which shows that there's heat in the liver. And then when we looked at her eyes, if you open your eyes, a bit closer up now. Now if you look this way, there's a vein. Can you see it? I don't know if you can see. Yeah, you can see that with the, you can see with the torch. Yeah, you can.
Oh yeah, with the torch.
It's better with the torch, isn't it? That vein on the inside shows heat in the heart. And also around the iris, it's shaded around the edges, sort of blurred, whitish around the edges, which shows liver deficiency. And the pupils are smallish, which shows kidney deficiency. And then, if you look up that way a bit more, down here there's some red vein going down to the bottom. The red vein going down to the bottom represents the uterine area, and then the vein going to the left represents the heart. So she's got some heat in the heart, some heat in the uterine area. I believe she's on period at the moment, which could be from that. And then her lips, Isabella, they're a little bit patchy, but there is some red in it, and there's some pale in it, and there's patchiness, which shows deficiencies in the composition of her blood. Okay, thank you.